The initiative to supply 3 months of hygiene products to PLHIV families across the region, in addition to Nigeria and Egypt, was conceptualized in partnership with RB as COVID-19 hit us all of a sudden in early 2020. The initiative successfully completed supplying over 220,000 hygiene kits to PLHIV families across 20 countries in Africa. It was a form of social protection for PLHIV households, as they were the ones most hit and most vulnerable to the impact of COVID-19. The initiative contributed in a modest way to empower the communities to take on the impact of colliding epidemics of HIV and COVID-19. We received lots of stories with human faces from countries, which shows the positive impact the project brought on human lives in these challenging times.
We felt that we had a unique ability to support people living with HIV and AIDS because of the connections we had, because of the brands we have, because of the products we have. And so the reason we decided to work with UNAIDS and particularly try and support people living with HIV and AIDS is we knew that it was a big issue. We knew there was a lot of uncertainty as to how COVID-19 would impact those communities. And we felt that genuinely we were very well placed to try and make a difference. I think the longer term impact of this initiative is our relationship and our partnership with UNAIDS. You know, as the owners of the Durex brand, you know, we have knowledge, we have people, and we have products that can make a huge difference in sub-Saharan Africa, particularly to people living with HIV/AIDS. And so it's very natural for us to have a strong partnership with a fantastic organization like UNAIDS.
I was very impressed, you know, by the initiative, and but also the fact that it was very targeted for a particularly vulnerable group that we work with. So in that sense, it was an extremely useful initiative, and you know, much appreciated by recipients themselves, by the beneficiaries, but also by countries, you know, which became aware of the support that was provided.
So we had worked in collaboration with UNDP, with WFP, with UNFPA, and UNAIDS. Our contribution was bringing in these hygiene packs. But also at the national level, there was a very strong acknowledgement of the contribution that the RB donation had made. We were addressing the needs of communities in a very practical way. And for us, we were responding and reaching out to a very diverse group that included people living with HIV, but also young people living with HIV, specifically looking at young people. And so we partnered with different groups to implementing partners so that we can reach the various identified target groups.
I'm Maureen Murenga from Lean On Me Foundation. Lean On Me Foundation is based in Kisumu and Siaya counties in Kenya. And we work with adolescent girls and young mothers living with HIV. What they really want to commend UNAIDS for was the support with the hygiene announced in our country. And it came at a time when we all understood that we need to wash our hands, and we need to. The availability of this donation brought some form of equity because we enabled those of our beneficiaries from resource-constrained regions to access prevention areas that we didn't have water. So there was some form of equity in ensuring that everyone was able to prevent COVID-19.
There are a lot of lessons learned on all sides, but the fact that we successfully partnered to deliver this critical support to people living with HIV and other important stakeholders, we will make it much more efficient next time round. And we look forward to a continued partnership with RB. And the government was very appreciative The United Nations system in Mozambique was very appreciative of this support, but most importantly, the beneficiaries of this donation were very, very, very appreciative.
We have 1.4 million people living with HIV, but the product managed to reach more than 20,000 people, which is a big number in terms of individuals. So if you're looking at the household, then the numbers were much more than that. The distribution took longer than expected because of the transport problem. We relied more on people who were coming in to the district and visiting the National Forum of People Living with HIV and AIDS offices to transport on behalf of the communities in the different districts. So that is where we had a hiccup, mainly around transport.
The support demonstrated that actually it was beyond health. It was beyond the normal sanitation and support for COVID aspect, but it addressed the broader issues of economic issues that continued to be addressed by a simple jig, if I can call it. It was able to help again address a number of issues that we could not be able to address and scabies. These simple initiatives then ultimately will contribute one by one. Will have addressed the unique inequalities that happen within the different setups of our community.
My name is Tricia Gentinzi. I am 49 years old. I'm living with HIV for 10 years. Hygiene packs came at the right time when the COVID was hitting hard in our province. Hygiene packs make our lives easy because we were able to follow the rules of COVID-19 by washing our hands with Dettol soap and clean our homes and our shacks. Ever since we received these hygiene packs during the time of COVID, none, and I mean none of us became sick. None of us was bedridden because of hygiene and because of COVID.
We sincerely appreciate the partnership of RB and thank Vinny, our Executive Director, Ines Chuma, our Regional Director, for their leadership. We want to extend our special thanks to governments in all the countries who were extremely supportive of this initiative, to PLHIV networks in different countries and the UNAIDS country teams with their partners. The project was very challenging because it involved lots of logistics, cutting across various international borders in the early times of COVID-19. However, the smiles on the recipients in the end gave us the satisfaction that all our efforts were worth it.